James Coles, I'm diabetic, have high blood pressure, 54-year-old black guy. What I need to be taking to get under 7? To get under 7, we have a new diabetic support product called Doctor's Diabetic Support, glucose, sugar support, that will help that as far as getting your blood sugar down. But the hemoglobin A1C is what you're talking about at 7. When you have high blood pressure and diabetes, you have what's called the metabolic syndrome. It's really 3 diseases: high blood pressure, high cholesterol, and diabetes. So those 3 things form a pyramid, and that pyramid is balanced. If you have to treat each of those disease states to keep your pyramid straight, if you treat one but you don't treat the others, you see how it skews the pyramid. So every visit that you go to the doctor, all 3 of those disease states need to be addressed. So you need to be on a cholesterol lowering medication if you are not already. You need to be on an effective regimen to control your blood pressure, which may be 2 medicines, 3 medicines. With diabetes, it may require more than 3. It's however many it takes. But that treatment regimen should include a drug in the class of angiotensin receptor blockers or ACE inhibitors. They protect the kidneys from damage that happens to the kidneys from the diabetes. Diabetes is the #1 cause of people going into renal failure and going on dialysis. So that class of drug is a must for a person that has a diagnosis of diabetes. Then whatever other class of drugs is required to control your blood pressure. The most common would be calcium channel blockers, such as nifedipine or amlodipine. Those in combination with an ACE or an ARB, and then you throw in a diuretic, a mild dose of diuretic. Hydrochlorothiazide is the most common. Those 3 things are at minimum what you should need to be on. You can get that. You can get all 3 of them in one pill, but most insurance companies won't cover it. So that you might have to get 2 pills to get that objective. Then major breakthroughs in the treatment of diabetes. You have the SGLT2 inhibitors, which would be Farxiga and Jardiance. Then you have the GLP-1s, which would be Mounjaro and Ozempic. So you should be on at least one of those drugs, or possibly the SGLT2 and the GLP-1 to control and get great control of your diabetes. That will lower your hemoglobin A1C and get you under 7 continuously, keep you under 7, and stop you from getting on insulin. If you're on insulin, that combination could result in you coming off of insulin. I take patients off of insulin all the time by using those 2 drugs. Sometimes you still have to stay on insulin, but at a much lower dose or a much less complicated regimen. Most of the time, just a basal insulin like Lantus or Basaglar will give you all the insulin that you need, versus taking mealtime insulin, which would be Humalog and Novolog, every time you eat, and then taking a basal insulin maybe even in the morning and the evening. So people can take as few as 1 insulin shot, and some people take as much as 7. But I can assure you that that treatment regimen that I just recommended with the SGLT2s, that would be Farxiga and or Jardiance, it's either or, Farxiga or Jardiance. And they found great benefit to prevention of heart attacks and strokes, as well as helping improve kidney function with that class of drug. When the drugs were first invented, because what they do is make you urinate out the sugar. Not only do you urinate out the sugar, you urinate out the calories associated with the sugar. So it makes you lose weight. And guess what? It's glucose dependent, which means that when your sugar normalizes, it cuts itself off. So you can't get low blood sugar from that class of drug, but you can get very well controlled diabetes blood sugar levels. So great job with that. And then, of course, the magic of the Ozempic or the Mounjaro. Either one of those, very good. We can get you under 7, no problem. You have to follow the regimen, which includes a diabetic diet that's low carb, so you're not eating sugar all the time. Doesn't mean you can't ever have a piece of cake, or that you can't, but you just can't have cake and ice cream and donuts all day, every day. Okay, James, great question.